Welcome to the Allogeneic Stem Cell Transplant education session. This presentation will help you, your family, friends, and caregiver understand what an allogeneic stem cell transplant is and what's involved in the transplant process. Here are the topics we'll explore in more detail during this session: the allogeneic stem cell transplant process, your healthcare team, the preparations for your stem cell transplant, including finding a donor, other preparations such as workup tests, physical, emotional, legal, financial, and finding accommodations, your Hickman line insertion, admission to the hospital. We'll also explain the stem cell transplant, what happens after your stem cell transplant, including discharge from the hospital and the role of your caregiver, and life after discharge. First, let's go over the allogeneic stem cell transplant and how it works. In an allogeneic stem cell transplant, the patient's stem cells are replaced with new healthy stem cells obtained from a donor, usually a sibling or unrelated donor. Before the stem cell infusion takes place, the patient will receive high-intensity chemotherapy with or without radiation. Allogeneic stem cell transplant is used to hopefully cure patients who have a high risk of relapse after their disease, who haven't responded fully to treatment, or have relapsed after a prior successful treatment. This type of transplant is often referred to as allo stem cell transplant. Hematopoietic, or blood stem cells, live in the bone marrow, the soft, spongy part in the middle of your bones. They're capable of self-renewing and can develop into the blood cells your body needs, including red blood cells, which carry oxygen throughout the body, white blood cells, which form the immune system and help to fight infections, and platelets, which help form clots to prevent bleeding. Normally, there are very few stem cells found in the bloodstream. There are three main steps of allogeneic stem cell transplant. First, stem cells are collected from a donor. The donor may be an immediate family member or someone unrelated to you. Second, you'll get high doses of chemotherapy and sometimes radiation. This treatment destroys cancer cells and clears your bone marrow to make room for the new stem cells to be infused. Lastly, the donor stem cells are infused into your body, much like a blood transfusion. These stem cells find their way into your bone marrow and start making new, healthy blood cells. Stem cell transplant is a long journey, but you have many supports along the way. Everyone's transplant journey is different. The timing of the process varies. After your stem cell transplant, you'll stay in the hospital for about 4 to 5 weeks, or longer if needed. After that, you'll need to stay in or near Saskatoon for at least another 3 to 4 months, so you're close to the center in case you have any complications. For the first 3 months, you'll have a lot of appointments and you'll need to be checked often. Once you start to stabilize, you'll have fewer appointments, but you will be followed for life. Our experienced, dedicated, and compassionate team of healthcare professionals are ready to support you every step of the way. Once you're referred to the transplant program, a hematologist will be assigned to you. A hematologist is a transplant doctor who specializes in diagnosing and treating conditions that arise in the blood and blood-forming tissues, including bone marrow. There are 4 physicians that care for allogeneic stem cell transplant patients: Dr. Elmery, Dr. Bosch, Dr. Kodad, and Dr. Sabri. You'll meet one of these doctors at your consult. During your time in hospital, you'll have different doctors caring for you, including clinical associates. They may change depending on their schedules, but all the doctors work together to provide the best care for you. Once you're discharged, your assigned transplant doctor will take over your outpatient care at the Saskatchewan Cancer Center. Transplant coordinators will help prepare you for your transplant. They'll arrange tests and procedures that are required prior to transplant. They'll teach you and your family what you need to know about stem cell transplant and possible side effects and complications. And they'll coordinate the timing of your transplant corresponding with the collection of stem cells from your donor. The registered nurses in the clinic are responsible for nursing assessments post-transplant, organizing your care after the transplant, and will be your main point of contact if you have any new symptoms or concerns. These dedicated team members provide support to patients and their loved ones during and after treatment. They provide counseling and support, resources, assistance with practical matters, and facilitate family meetings. Our inpatient and outpatient pharmacists help teach you about chemotherapy and other medications you'll take during your stem cell transplant. Once discharged, you'll be provided with a medication schedule, and they'll teach you how to manage your medications at home. Pharmacists work closely with your doctor to decide which medications may help you the best. The team on Unit 6100 is made up of many people who will care for you during your hospital stay. Our clinical associate physicians will provide day-to-day care. Nurses, pharmacists, dietitians, transfusion medicine lab staff, physiotherapists, occupational therapists, and many others will help with your care. You are an integral part of the team, and you have a vital role to play in your care and recovery. As you know yourself best, we depend on you to report how you are feeling and how the treatment and other factors are affecting you. Your family or caregiver will also play a vital role in this. First, let's go over the process of finding a donor. The search for a donor starts early. HLA antigens are like flags on the surface of cells. Your immune system uses HLA markers to know which cells belong in your body and which do not. Half of these markers come from your mother and half from your father. Before we can find you a donor, your blood will be tested to detect your human leukocyte antigen or HLA type. Your HLA typing is compared to your potential donor's typing to see if you're a match. You'll be asked for your siblings' names and contact information. Our donor search coordinator will then contact your siblings to arrange a blood test for HLA typing to see if they're a match to you. This blood test can be done close to your siblings' home. The three main types of stem cell donors include a relative or full match, which would be a sibling, a relative or a half match, which is a parent, sibling, or child, unrelated, someone unrelated to you. You have a 25% chance of being fully matched to a sibling. A biological parent will always be a half match. A child would also be a half match to their parent. If we find a related donor, he or she will be seen at the Saskatchewan Cancer Clinic by another transplant physician and assessed for suitability with an extensive health history, physical examination, electrocardiogram, chest X-ray for donors who have a history of smoking, bone marrow biopsy if over the age of 60, along with other tests as required. Most patients will also have an unrelated donor search done. You'll be given a consent form called the Privacy Notice to Patients from Canadian Blood Services or CBS if this is to be started. The CBS registry coordinates unrelated donor searches in Canada with other registries worldwide, giving access to more than 30 million donors worldwide. Confidentiality is critical with unrelated donors. Any identifying characteristics of your donor, including age, gender, name, and location, cannot be disclosed. Your identifying information will not be shared with the donor. Anonymous correspondence may be allowed and will be facilitated through CBS. Depending on the registry that your donor came from, You may be permitted to contact them 1 or 2 years post-transplant. To make contact with your donor, the donor and patient must sign consent forms to release personal information to each other. The donor search coordinator can facilitate this through CBS. The unrelated donor screening is essentially the same as the related donor screening. Preparing for your stem cell transplant. What you can expect leading up to your procedure. We'll cover finding a donor and other preparations that you need to complete. Stem cell transplant is a lengthy process. It starts with debulking chemotherapy, pre-transplant assessments, donor stem cell harvest, admission to hospital, and conditioning chemotherapy, stem cell infusion, and then recovery both as an inpatient and outpatient. It ends with your life having a new normal. Once a donor has been identified, you'll have a stem cell transplant consult with our transplant team to talk about why the transplant is an important part of your treatment, how the transplant will benefit you, how long the time commitment could be, the tests and procedures needed before the transplant, financial costs as well as medicine and drug coverage, the role of a caregiver, the expected risks, complications, and possible side effects, and what other options are available. Your transplant coordinator is always available to answer any questions. Moving forward with this transplant is your decision. Rely on the information provided to you, your transplant meeting, conversations with your healthcare team, family and friends, to fully understand the process. If you choose to have the transplant, you'll need to sign a consent form. Many patients will have already been receiving debulking chemotherapy to help lessen the disease. Patients must also respond to this chemotherapy before transplant. It's often given as outpatient. The treatment varies dependent on the disease. Workup tests before your transplant. When you decide to proceed with stem cell transplant, we'll begin planning your schedule of tests and procedures. A number of tests are needed to ensure you're ready for transplant. This will be a very busy time for you, as you have many appointments. 2 main areas need to be assessed: your cancer disease status and your overall health. You will need to have a physical exam, disease reevaluation such as CT and PET scan, screening blood work, viral screening, renal and liver, a pulmonary function test to test your lung function, an echocardiogram, a heart function test, a dental appointment. You'll need a cleaning and clearance from the dentist before we can proceed. This must be done within 4 months of transplant. An ophthalmology assessment. You'll be referred to Dr. Sharma, an ophthalmologist in Saskatoon, to have a baseline eye test done. This way, if there are any issues after transplant, we can earlier detect and treat problems. For patients who will receive total body irradiation as part of their conditioning regimen, you'll meet with a radiation oncologist and have a radiation planning CT done at the Saskatchewan Cancer Center. Have a fertility discussion. If fertility is a concern to you, please talk to your transplant team. A referral can be made for you to see a fertility specialist to talk about your options for fertility preservation. Before your stem cell transplant, there are many steps to complete to get yourself ready. Some of those preparations include physical, emotional, legal, financial, and other costs to consider, finding accommodations, and the requirement of a caregiver and relocation to Saskatoon. While you're completing your treatments and undergoing pre-transplant assessments, there are a few things you need to think about. Exercise. Many people keep up with their regular exercise program or start a new one in preparation for their transplant. This is dependent on your present activity level and physical condition. Exercise is a positive way to channel stress and promote general well-being. Generally, the more conditioned you are, the better you will be able to physically manage transplant and recovery. Nutrition. Eating healthy and meeting basic nutritional pre- and post-transplant needs is important. A referral to our outpatient dietitian can be arranged for nutritional concerns. Hair loss. Unfortunately, you'll lose your hair during this process. You may want to shave your head ahead of time, purchase a wig, or have a favorite hat or scarf with you. Smoking cessation. If you smoke, vape, or use tobacco products, you're strongly encouraged to quit smoking prior to being admitted to hospital for stem cell transplant. This will help you have a better chance of successful treatment, fewer serious side effects, a faster recovery from treatment, a lower risk of infection, easier breathing, more energy, and better quality of life. Once admitted to the ward, your blood cell counts will decrease, and you'll be unable to leave the ward to smoke. Ask a member of your healthcare team if you need help with quitting smoking. There are a number of supports available. Following stem cell transplant, we recommend not smoking and avoiding secondhand smoke, as both can increase your risk for infection, lung complications, or a second malignancy. This process can be overwhelming at times. You're dealing with a lot, battling a disease, considering an entirely new, lengthy, and complex treatment plan, which does come with some side effects and risks. There's a lot of new information and medical jargon to wrap your head around before you decide if this treatment plan is right for you. So understandably, you may be feeling a lot of emotions, including fear, frustration, anticipation, and also hope. Your transplant journey ahead is full on uncertainties. The process is different for everyone, and the unknowns can be difficult to cope with. Your social worker is available for counseling sessions and can recommend other resources for emotional support. Legal, getting your affairs in order. It's a good idea to have a healthcare directive filled out so your family and transplant team can carry out your wishes if you cannot speak for yourself. The healthcare directive discusses your wishes regarding medical treatment. It can also name a proxy or decision maker. If you need help making one, you can use the My Voice booklet from the Saskatchewan Cancer Agency. A current will is also important to have regardless of health status. It's a legal document expressing your wishes. If you have questions, you can talk with your social worker or lawyer, or visit www.plea.org for more legal information. Financial considerations and assistance. It's important to review your financial resources and needs. You'll be required to take a leave from work for at least 1 year post-stem cell transplant. The exact time period is different for everyone depending on the type of work you do and how you're feeling. Contact your employer to find out what you have available for sick leave, short-term and long-term disability. Contact the Government of Canada regarding accessing CPP or EI medical benefits. If you need financial help, ask your social worker. They can help with accessing other sources such as Kinsman funding. Here are some of the other costs you may have to cover throughout your stem cell transplant journey. You'll be responsible for costs associated with parking. You may want to consider buying a parking pass for Royal University Hospital. Parking is $18 a day. Weekly and monthly passes are available. Internet connection is free. Once you're admitted to the hospital, you can ask a nurse to help you get connected to Wi-Fi. Medications. You'll receive a number of different medications when you're discharged. Some coverage options to help with medication costs include third-party drug coverage such as Blue Cross, Special Support Program, and Seniors Drug Coverage. All transplant patients will receive a special support application in the mail prior to transplant. Everyone is encouraged to fill out this application as it can lower the cost of your prescription medications. All transplant patients need to prepare to relocate to Saskatoon or surrounding area within 30 minutes for a period of approximately 3 to 6 months. Your social worker can provide you with an accommodation guide if you need help finding a place to stay. While you're admitted to the hospital for your stem cell transplant, your caregiver or family members may also wish to stay in Saskatoon during that time. Your transplant will take place at Royal University Hospital on Unit 6100. You will have a Hickman line inserted a day or two prior to admission to the hospital. It's a long, flexible tube inserted under the skin of your chest with the help of an ultrasound machine. It's often referred to as your central line. You'll be given local freezing for this procedure. After it's inserted, you'll be required to recover for a couple of hours. Your central line will be used to infuse your stem cells, draw blood, give chemotherapy, IV fluids, medications, and blood transfusions. That's the benefit of the central line. You'll not have to be poked constantly for blood samples, and you can get medications and chemotherapy using the line instead of starting an IV, intravenous. Caring for your central line. The insertion site will feel tender for a short time. The line needs to be kept dry, so clear dressing will be placed on top. The dressing needs to be changed by a nurse at least once a week. Your nurse will teach you how to care for your line to help prevent infection. You'll need to cover your central line site before having a shower or bath. The line will stay in as long as you need it. Most people have their central line for about 3 months after transplant. Welcome to the Royal University Hospital. You'll stay on Unit 6100 for about 4 to 5 weeks from the time conditioning starts to when you're discharged. If you have any problems, you may be in the hospital longer. Visitors are allowed on Unit 6100. There are no set hours. Review the visiting hour policy upon admission, and please note that no fresh or dried flowers are allowed on this unit. All visitors must be healthy, wash their hands when entering the unit, and wear a medical-grade mask. Sleep chairs may be available in each room if you'd like someone to stay overnight with you. There are no shower facilities available for visitors to use. Children 12 years old and younger are not allowed to visit the unit. You may want to bring a few things from home with you to the hospital. We recommend that you consider bringing fun activities and games that'll help pass the time, such as books, crafts, puzzles, crosswords, etc. A laptop, computer, or phone, including chargers. Your own clothes or pajamas if you choose. Also note that no laundry facilities are available at Royal University Hospital. Comfortable walking shoes. Toiletries are provided, but you may want to bring your own soap and shampoo, soft toilet paper and Kleenex, toothbrush and toothpaste, photos to decorate your room and hang on your whiteboard. You may also want to bring in shelf-stable snacks to be kept in your room. There is a fridge staff can store your labeled snacks. Family members may bring in meals for you as well. We recommend that you refer to the dietitian handout about what types of foods to stay away from while your immune system is low. You also need to follow the proper safety precautions for preparing food for patients with compromised immune systems. High-dose chemotherapy and your stem cell transplant. Let's go over everything you need to know about the process. Once you're admitted to hospital, your conditioning chemotherapy will start the next morning. Chemotherapy, with or without total body irradiation, TBI, is used to control your disease and prepare your body to accept the new stem cells. There are a variety of conditioning regimens. The regimen you receive is based on your age, disease, comorbidities, and type of donor. The conditioning treatment will be high-dose, myeloablative, or reduced intensity, non-myeloablative. Most patients will receive 5 to 7 days of chemotherapy. Total body irradiation often serves as part of the preparative regimen for patients who will undergo chemotherapy and stem cell transplant. TBI suppresses or lowers the immune system to help prevent the body from rejecting the donated stem cells. TBI can also help to destroy any remaining cancer cells in the body. Total body irradiation treatments are painless, and treatment time is about 1 hour. Depending on your diagnosis, TBI may be delivered as a single treatment or fraction, or up to a total of 6 fractions. This takes place over 1 to 3 days before the stem cell infusion. If you need total body irradiation or TBI, you'll have a CT scan at the cancer center 1 to 2 weeks before your admission to the hospital. The scan will produce a 3D model of your body to help with treatment planning. A beanbag will be fitted for you to help lay still for the treatment. Stem cells can be collected from your donor 2 ways: by a peripheral blood stem cell collection, which uses stem cell stimulating injections for 5 days, and an apheresis machine which separates the blood, or a bone marrow harvest, which is performed under general anesthetic in the operating room. A needle is inserted into the pelvic bone where a large quantity of bone marrow is extracted with a syringe. The peripheral method is the most common way to collect stem cells. Your physician will decide which one of these methods will be used based on a number of factors, including the type of your disease. Related donors will give themselves 5 days of GCSF injections, and then come to Saskatoon to be placed on the apheresis machine. Collection usually takes just 1 day, but occasionally 2 days are required. Related donors may need a temporary line inserted for collection. Otherwise, 2 peripheral IVs are used. Unrelated donors are collected in their home country, and stem cells are then transported to Saskatoon. We've finally made it to your transplant day, which is often called Day Zero. For some, this day is a celebration of a new beginning and often considered a second birthday. The donor stem cells are brought to your room and infused intravenously through your Hickman line. Your blood pressure, pulse, and oxygen saturation are monitored by your nurse throughout the infusion. Once your stem cells are transplanted into your body, they'll enter your bloodstream and move into the bone marrow. Here they start making new blood cells. It may take 2 to 3 weeks for new blood cells to be produced and for your blood counts to begin recovering. When they do, this is called engraftment. Engraftment can take longer depending on the source of your stem cells. While you're waiting for engraftment, you will have very few cells to protect you from infection or bleeding. As your blood counts begin to rise, that means the stem cells are starting to create normal blood cells again. It's important to remember that even when your blood counts are at normal levels, you are still at a higher risk of infection. This will last for up to 12 months after transplant. About 1 week after starting chemotherapy, you'll begin to feel tired and unwell from the side effects of the chemotherapy. Fatigue is common, especially while your blood counts are very low. A fever is often the first sign of infection. Almost everyone will get an infection in hospital and require IV antibiotics. You'll experience hair loss. The treatment damages cells that grow quickly, and hair is made up of fast-growing cells. You'll probably begin to lose your hair between 14 and 21 days after starting treatment. Digestive problems can occur because tissues in the mouth, stomach, and intestines are sensitive to chemotherapy drugs given before transplant. Mucositis is when the mucous membranes become irritated and swollen. This can lead to painful sores, bleeding, and infection. Good mouth care can help prevent infection and promote healing. You may need medications to help control diarrhea, nausea, and vomiting. Organ damage to your kidneys or liver, for example, can happen. This is usually reversible. Most of these problems are worse when the blood counts are very low. This is usually about 1 to 3 weeks after the transplant. Both during and after your transplant, you'll be closely monitored for infections and low blood counts. The nurse will draw your blood every morning at around 6 a.m. You'll be given blood and platelet transfusions as required. Most patients require IV antibiotics. You'll get a daily weight check, and a nurse will be monitoring your intake and output. As part of your daily routine at the hospital, you'll need to shower daily to maintain good hygiene and lower the risk of an infection. Wash your hands frequently and use hand sanitizer. Wear a mask when you leave your room and when you leave and return to the hospital. Follow proper mouth care, which will include rinsing your mouth frequently with club soda or prescribed mouthwash to prevent mouth sores or infection. It's also important to exercise and stay active to maintain strength, as it can aid in recovery times and lead to earlier discharge. A physiotherapist can provide exercises. And be sure to eat and drink, even small amounts throughout the day. The treatment may affect your appetite and ability to digest food. You may experience nausea, changes in taste and smell, and difficulty swallowing. You can do your part to reduce your risk of infection by following a few basic practices. Practice good hygiene. Wash your hands regularly, before meals, before meds, after using the bathroom. Have your visitors entering your room isogel or wash their hands. Masks are also required. Encourage visitors not to come to the hospital if they're not feeling well. What can you expect after your discharge from the hospital? About 4 weeks after your transplant, you'll be ready for discharge when your blood counts have recovered and are not transfusion dependent. There's no active infection requiring IV antibiotics, or you're able to run antibiotics at home. You're taking all your medications orally. You're eating and drinking an acceptable amount. You're mobile and have the strength to complete regular daily activities. Your energy level will not yet be back to normal. You'll have a lot of different appointments and treatments to attend after leaving the hospital. The appointment frequency depends on your health concerns, but generally you'll come to the cancer center 3 times per week. Once per week to see your transplant physician, and 2 times per week to see your transplant nurse. Your Hickman line will stay with you for a number of months after leaving the hospital. Day 100 or 3 months post-transplant usually marks the end of early recovery phase after transplant. At this time, you may have a bone marrow biopsy, CT, or PET scan done to reevaluate your disease. Your doctor may discuss removing your central line shortly after, and the transplant team will decide if you are well enough to return home. You will continue to have follow-up appointments at the Saskatchewan Cancer Center, but their frequency will decrease. You may require other appointments with other specialists as well. You will receive some medications when you're discharged, including an antiviral for 3 to 6 months, an antibiotic for 1 year, immunosuppressants, antifungal medication, electrolytes like magnesium, potassium, and calcium, anti-nauseants, antacids, and others. Some patients may also be on the home IV program for antiviral medication. What can you expect in terms of sexual activity after discharge? You may notice changes in your desire and sexuality after your transplant. Men may have lower testosterone levels after chemotherapy and a lower sex drive. Women may experience hot flashes, vaginal dryness, or less interest in having sex. Generally, sexual activity after your hospital stay is considered safe to participate in unless your platelets are low, which puts you at risk of bleeding. Your neutrophils are low, which makes it easier to get an infection. As mentioned earlier in the side effects slide, now we'll discuss graft versus host disease in greater detail. Graft versus host disease is when newly transplanted stem cells see your body as foreign and attack it, causing side effects. Before transplant, HLA typing was done to see how closely your donor was matched to you. GVHD is less likely to occur, or symptoms will be milder when the match is closer. There are 2 types of graft versus host disease, acute and chronic. Acute GVHD usually happens within the first 3 months after transplant. It's graded from 1 to 4 depending on the extent and severity. It usually affects 3 areas. The skin can present as itchy red skin or raised red rash on any part of your body. The liver, elevated liver enzymes on blood work causing liver dysfunction. The gastrointestinal tract. You could experience abdominal pain, nausea, vomiting, or diarrhea. Chronic graft versus host disease usually starts more than 3 months after transplant and can last a lifetime. The severity is scored as mild, moderate, or severe. It can affect any body system, including eyes. You may experience dry, burning, gritty feeling, blurry vision. Liver. You may get abnormal blood tests, pain, yellow discoloration of skin. Skin. You could get a rash, discolored areas, skin tightening or thickening. Nail. You may notice nail ridging. Gastrointestinal tract. You may experience nausea, vomiting, diarrhea, and dry mouth. Mouth. You could get mouth sores, pain, ridging. Joints and muscles. You may feel pain and stiffness, muscle pain, cramps, or weakness. Lungs. You may have shortness of breath, cough, trouble breathing. Genitals. You may feel dryness or irritation, rash, painful intercourse. To make the diagnosis of GVHD, several lab or imaging tests can be done, including biopsy, investigations such as gastroscopy or colonoscopy, blood work, physical examination, imaging tests. After transplant, you'll be discharged home on medications that suppress the immune system. Cyclosporin or tacrolimus. These medications will reduce the chances or severity of GVHD. If you develop GVHD, it is most commonly treated with oral or IV steroids, prednisone, oral immunosuppressive medications, topical creams and solutions, light therapy or extracorporeal photopheresis, ECP, other immunosuppressive treatments. You can reduce your risk of GVHD by taking all of your medications as directed. Let your nurse, doctor, or pharmacist know if you're unable to take your medication for any reason. Watch for early warning signs. Tell your healthcare team right away if you have any symptoms. GVHD can be serious and life-threatening. Treating it early is the best way to control the disease by not exposing yourself to the sun's ultraviolet rays. So take all the necessary precautions to protect yourself from the sun. Your caregiver will be a key support for you throughout your recovery journey. Caregivers can be an important part of your transplant team and your recovery. This person is usually a family member or close friend that is very reliable and can agree to commit to the full-time responsibility of this role. The amount of time you need a caregiver will depend on your condition and recovery after transplant, but you need to have a plan to have a caregiver for at least 3 months post-transplant. A stem cell transplant is not something you can manage by yourself. You may feel very tired and weak and may have complications after your transplant. Your caregiver will help you with tasks like transportation to appointments, help with medications, monitoring your health and vital signs such as temperature, providing nutritional support, maintaining your home environment such as cleaning, shopping. Caregivers can go out for short periods of time to get groceries, for instance, but should be available by phone and be able to get back to you within 15 minutes in case of an emergency. Your caregiver also needs support. Being a caregiver can be a demanding role. They take on a lot of information and responsibility. Caregivers also need to practice self-care by taking breaks, having personal time, getting enough sleep, practicing good nutrition. Counseling support is also available for caregivers from our social work department. Life after discharge. What does your life look like now? For many people, it takes months to years to recover from a stem cell transplant. Recovery depends on many factors, such as overall health status, age, medical complications, prior level of activity, individual variation. For some patients, recovery time is relatively short. For others, the recovery period is slow, and some will never feel the same as they did before transplant. You'll need to remain off work or from school for at least 1 year. You may feel a bit lost once you're discharged from hospital. Some people feel down or anxious as they go through the change from staying in the hospital to leaving the hospital. These feelings are normal. You may need to be readmitted to hospital if any problems come up. This can be disappointing, but it is not uncommon after transplant. After transplant, some people expect to feel as well as they did before they got sick. This is not always possible, especially right away. You'll still need help from your family after the transplant. Family members might not understand how long it takes to recover, which may cause some relationship struggles. Regarding your recovery, generally you can expect a long recovery, fatigue. You may have chronic graft versus host disease, which is managed by immunosuppressive medications, side effects from medications, continued medicalization, including blood work, follow-up appointments, possible platelet and blood transfusions, potential infections, readmissions to hospital to manage complications and symptoms. Transplant is not always successful. Some patients experience relapse and life-threatening complications or chronic long-term complications. The recovery period may take a year, and in some cases, even longer. There are many things you can do to keep your environment clean and keep yourself as healthy as possible during your recovery. We recommend that you have your house clean prior to coming home. Change the air filters in your furnace once a month. Keep your environment clean. Stay away from molds and dust. Plants and soil contain bacteria, molds, and fungi, so they should be avoided. Avoid new construction, sawdust, and environmental chemicals, such as glue or paint. Keep your hands and body clean. Frequent hand washing and daily bathing. Family pets can stay in the home, but someone else needs to clean up after them. Avoid crowds by visiting public places during less popular and busy times. Protect yourself from the sun. Stop smoking and avoid secondhand smoke. Do not wade or swim in pools, hot tubs, ponds, or lakes. After transplant, you'll also need to have chimerism testing at certain intervals. It's a blood test done to evaluate what percentage of your blood cells are your own and what percentage are your donors. The goal is for you to convert your donor cells or immune system fully. Some of the delayed or long-term risks include infections. You could have lung damage from chemotherapy or graft versus host disease. You're on immunosuppressive medications, which will make you more susceptible to getting an infection. Sterility is likely post-transplant. Fertility preservation should be considered prior to transplant if you're interested in having children post-transplant. Cataracts or other eye problems. Bone complications like osteopenia, osteoporosis. Bone density tests will be done periodically post-transplant to monitor for these. Prolonged fatigue. Health effects from graft versus host disease, GVHD. Relapse. Routine scans and bone marrow biopsies are done post-transplant. Secondary malignancies such as leukemia, skin cancer. Be sun smart. Your immune system will be weak after transplant, and you'll be at risk for getting infections. It can take up to a year after transplant for your immune system to work as well as it should. It can take even longer for patients with graft versus host disease who are on immunosuppression. You may have to take these medications for a long time to control graft versus host disease. Types of infections can be bacterial, fungal, viral. Viruses that your immune system helped control before transplant can become active after you have a transplant. Cytomegalovirus, CMV, Epstein-Barr virus, EBV. We will monitor your blood for these viruses and give you medication if needed. Infections are most often caused by, passed on from other people, from plants, soil, or the outdoors, from animals or insects, from tainted or undercooked food, from germs that live inside your body. After your transplant, you'll need to be re-immunized for all of your vaccinations. You'll receive letters in the mail when you're eligible to schedule those vaccinations. Here's your approximate timeline. By 4 months, you'll need your COVID and influenza vaccinations. By 6 months, you'll need your pneumonia vaccinations. At 1 year, you'll need killed vaccinations such as hepatitis B. At 2 years, you'll need live vaccines such as mumps, measles, and rubella. You can usually return to work in about 1 year after your transplant. This varies based on how you're feeling and your work environment. It may help to begin slowly. As for traveling, we recommend that you talk to your transplant team if planning to travel. Camping, hunting, and fishing are discouraged during the early post-transplant period. It's important to prioritize your health and wellness. Make sure to continue regular activity and exercise. It may be helpful to follow a regular exercise program. Fatigue is very real. Give yourself time to rest. Fatigue tends to last for some time after transplant, so increase activity over time as your energy levels increase. Recovery depends upon a lot of factors, but the one thing that every patient should do is prioritize self-care. You can reduce stress and feel more calm and relaxed by listening to meditations or music, watching a funny show, practicing deep breathing, seeking out local support groups, focusing on your spirituality, and doing your favorite activities or pastimes that make you happy, such as games, puzzles, art, etc. Make sure to take your recovery 1 day at a time. Be gentle with yourself and others. Allow yourself to feel and express all of your different emotions. Make your needs known to yourself and the people around you. Talk to, lean on, and get help from your family, friends, and caregivers. These links include more information on advocacy, peer support, support groups, online chats, and other resources. Do you have any questions or concerns? Go to saskcancer.ca for more information and resources. You can also reach out to your transplant coordinators, Tamara and Stephanie, anytime, and they'll be happy to help answer any questions you may have.